Friends, after my first views on coronavirus disease, I wish to give some of these additional facts and update you on this as from the Gulbarga city. With the whole city is in panic and a lot of anxiety is prevailing in the society because of the death of one 76-year-old man yesterday. So, but I think in this context, I want to say that there is a disproportionate anxiety and the stress among the society when compared to the factual things which is happening. So that's one point, number one. So the need of the hour is what we need today is that we have to behave maturely with calm mind. That's one. Like you must stop gossiping and spreading the news which is unscientific methods of approaching the corona disease or corona victim or the contacts. That's number one. And second thing is the misconcept about the food and yoga. You see, the people have stopped buying fruits, people have stopped taking non-veg, people are stopped taking vegetables. This is something very funny about it, and people are scared of getting into the market of some object made in China. See, this is all misconceptions. The things which have occurred is late, and there is no question of the food discretion. It should be nicely good cooked food, number one. Second thing is the food is not going to cause anything. It is from human to human. The third is of course thorough washing of vegetables, other things. This is very, very important. And Chinese food. Yes, people are very fond of Chinese food. Chinese food cannot give you a Chinese disease of a corona. That's very, very bad misconception. Eating Chinese food, people have stopped it. Anything hot, steaming, served food is hygienic and nicely served is good. That's one. And so therefore there are some misconceptions like yoga. People say that you do the pranayama and breathing exercise, but pranayama, forced breathing exercise will force your the virons from the throat and nasopharynx deep into the respiratory, causing more chances of pneumonia, especially if you have a flu. So don't follow all these things. That is for improving immunity before getting any disease or to prevent any disease. That's one. Second thing is the simple hand washing method with a soap, 10 to 20 seconds thorough wash, if possible alcohol based sanitizer, using a mask. Any mask you can use as a general population is only 3M N95 mask to be used for the health professionals and the doctors, because they come in contact with regular patients of flu, cold, cough and other things. But other people can just have a ordinary mask and avoid crowd, avoid all those malls, bazaars, jatras, the meetings and the community meetings and other things. Try to be at home as far as possible, trying to this thing, and make a distance of 1 to 2 meters between person to person, especially when the person is having some flu or some symptoms like that. You have to maintain this and wear a mask. That's one. Then third thing is the unnecessary giving a misinformation on the viral being all your views, non-doctors and non-these things. Anybody can talk and anything. This will cause more panicky. Third thing is a quarantine. See, admit the patient who is suspected of that, definitely. Isolate the contacts who have come in contact with the that corona patient. They can be quarantined in a separate ward, an isolation ward, or he can be quarantined in his own house with a good ventilation. No AC. AC can produce a lot of harm things. But one person should deal with his food and needs, and he should be kept separately in the house. That's one thing. That will serve the president. Unless the patient has got suspicion. Positive patients has to be isolated thoroughly and watched thoroughly. All the people need quarantine for the incubation period to be over. So they watch and repeatedly doing the coronavirus test, and since once it becomes negative, you can discharge the patient. Only thing is, you got to mention some of these very simple measures. That's all. You need not have a headache, because immunity you will knock down by anxiety. Lot of psychiatric diseases are going to come after the corona, because everyone is depressed, everyone is having anxiety, everyone has got a question. That's my plea, sir.
Sir,